All right, good morning, everybody. Thank you all for being here. Today is an important day. This is the day when all adults, every Connecticut resident over the age of 16 is eligible to get the coronavirus vaccine. This is a milestone in our effort as a state and as a community to beat this virus and put this pandemic in the past. We know that it's going to be many weeks and months before we are able to get everybody vaccinated, but this does represent a really important milestone. And I'm especially proud to be here today with our health department, the Hartford Health and Human Services Department, and our director, Liani Arroyo, whose team has been working nonstop around the clock to get our community vaccinated, to do the outreach, to make phone calls, knock on doors, and deliver those vaccines. And also with one of our critical partners, Hartford HealthCare, Hartford Hospital, who has been a phenomenal partner, creative and aggressive in getting mobile clinics out into our community, running two of the largest vaccination sites in the state right here in Hartford, both at the Xfinity Theater and at the Convention Center, and grateful for their partnership today in this clinic that is jointly run by our Hartford Health Department and Hartford Hospital to get our DPW workers vaccinated. We're thrilled to have the opportunity to open this clinic, and unlike before, not just take those who were eligible based on age, but take every single one of our DPW crew who's ready and now eligible to get that vaccine. And I'm especially excited to be joining those employees today. I'm thrilled to be sitting down along with our DPW team to get this vaccine. I can't wait to get it and look forward to it, but mostly I just want to express huge gratitude to all of our partners and our team here in Hartford who are working so hard every day to get this vaccine out to our community, to remove barriers, to make it as accessible and easy as possible. The other thing I want to share is that a little bit later this afternoon, we're going to be hosting what is one of the first no appointment necessary clinics in Connecticut for Hartford residents over at the Walmart on Flatbush Avenue. This will be the first in a series of clinics that we're holding for Hartford residents that do not require an appointment. They're walk-up clinics. Again, we view that as a part of our effort as a community to eliminate every barrier we can to make it as easy as possible and as accessible as possible to our community. Because again, the way we put this pandemic in the past is by getting vaccinated. The last thing, I keep saying that, but this is truly the last thing, is that as our team today sits down to get vaccinated, and when I roll up my sleeve to get vaccinated today, along with everybody else who's getting vaccinated, you're getting vaccinated not just for you, but for those you love, for those you work with, for your classmates or colleagues, and for your community. And so to everyone out there who may still have some questions about whether they ought to get vaccinated, please remember, just like wearing a mask isn't just about you, it's about everybody around you, it's about your community, it's about beating this virus. The same thing is true about the vaccine. So please sign up to get the vaccine, get that appointment, come to one of our clinics. Protect yourself, but just as importantly, protect those around you, protect your community so we can put this pandemic in the past. Now, it's with enormous pride that I turn this over to our Director of Health and Human Services, Liani Arroyo, who truly is tireless in her efforts, along with her team, to keep our community healthy and safe and get our community vaccinated. Liani, thank you so much, and over to you.
Thank you. We are so excited today. I feel like it's the Super Bowl for the city of Hartford. It's the first day that we've been planning for and waiting for. And so we are very pleased to be able to be here with one of our valued partners, with Hartford HealthCare, Hartford Hospital, as a vaccinator here for our DPW staff. I want to thank our Department of Public Works staff for working with us so quickly to get this going. When we heard about the change, we knew that this was the first place we wanted to come. They are frontline workers, and they needed to be vaccinated as quickly as possible. So we're so pleased to be able to join here with Hartford HealthCare to do that today. Today it's truly a big day for us at the health department. We are going to more than double the amount of people in the city of Hartford that are eligible for a vaccination, from 40,000 to just about 97,000 individuals in the city. So we know that we have a lot of work to do. We're up for the challenge, and we know that we are but a small player in a larger puzzle here in the city with our partners, and we're looking forward to continue to work with them. Again, thank you to the mayor for his support of our team and the work that we've been doing. Thank you to our partners. And I just want to say a few words in Spanish to the Latino community today as well. Hoy es un día muy grande para la comunidad aquí en la ciudad de Hartford. Vamos a aumentar más de doble, más por el 100% de las personas que están elegibles para vacunarse aquí en la ciudad. Así que le estamos pidiendo paciencia y estamos pidiendo también que se vacunen. Estamos en una pandemia todavía, esta pandemia sigue, y la manera de cual vamos a salir de la pandemia es con la vacunación. Así que los esperamos ver en las clínicas móviles que estamos haciendo en estas próximas 2 semanas. Son sin citas. Tenemos personas que hablan español y estamos contando con ustedes para ayudarnos a salir de la pandemia. And with that, turning it over to one of our valued partners, the president of Hartford Hospital, Bimal Patel.
Thank you, Mayor, and thank you for the team to arrange such a great presentation and the event today to recognize and celebrate the penetration of vaccination in our communities. When the pandemic hit us, Hartford HealthCare had one only goal in mind: to take care of residents of our great state. The Nutmeg State needed to be the first in caring for our people. That was our goal. And we demonstrated by doing more than 1 million tests early on to provide the safety and security for Connecticut residents, followed by caring for people who were sick through 7 hospitals and 9 emergency departments across Hartford HealthCare. Soon thereafter, when vaccines were available, we stood up major mega sites with the capacity to do nearly 60,000 vaccines per week. All of this is possible because of the great partnership, great leadership of both Hartford HealthCare at the state level with the governor. We are fortunate to have amazing teamwork. The members who are ready, people are coming out of retirement to vaccinate folks. Today, Hartford HealthCare has done more than 250,000 vaccinations across the state of Connecticut. 120,000 people have been vaccinated fully with both doses. We continue to partner with cities, local authorities, bringing civic communities together, places of worship, churches together. We're doing, at any given day, 1, 2 to 5 clinics in the city of Hartford, giving access to people who can walk to those centers where they are very familiar with every single day. With that access opening through our mega sites that Mayor mentioned, this is available for our community. So the message should be vaccines should be acquired, vaccines should be distributed, vaccines should be given, and Hartford HealthCare is proud to partner with so many facets through multiple channels to provide the vaccine for our community. We are thankful for the opportunity today. We are for the opportunity tomorrow to make our communities healthy. Thank you for the great partnership and having us here today.
Hi guys. So my name is Keith Grant, Infection Prevention, Hartford HealthCare, and like in the process of getting to this point, there's so much that's been achieved. I think to me, one of the highlights of this is the partnerships that we've found, right? Every person here have contributed significantly. You know, the mayor's office, the federal government, working with state and local government in order to get us to the decision to open now access to over 1 million people within Connecticut are now eligible. Additionally, are now eligible to get vaccinated. But not only that, there's a number of facilities that are in Connecticut that has ramped up on staffing, on logistic, on infrastructure in order to facilitate this. So from a vaccination perspective, we're doing quite well. And I think we're more than prepared with this new numbers or the new people that are eligible to get vaccinated. And we've put so much work into this. Another thing that I want to really talk about really quickly, if we look at the numbers, we talk about the prevalence a lot. The prevalence has changed, has increased and decreased quite significantly over the last few weeks, and that's something we need to really pay close attention to. So I realize a lot of people's been vaccinated. We've done very well, and I just talked about that. If you look at the 65 plus, over 80% of these individuals are vaccinated. Or nursing homes, significant numbers are vaccinated, over 80 to 90%. Healthcare providers, significant numbers are vaccinated. We still have individuals, or 40 plus individuals, who are getting to the vaccination stations, but their primary vectors at this point, we've seen increase in these individuals in the hospitals and having cases. So still the vigilance that got us to the point of security in the state of Connecticut, still maintain that vigilance. Be aware of any symptoms, get tested as soon as possible. There's a number, Bimal talked about our testing initiatives in Connecticut, exceptional. Still get tested. If you think you're symptomatic or you feel symptomatic or been exposed, get tested. Social distancing, ensuring that you're wearing your mask, very, very, very important. There's conversations about variants. Obviously we're seeing some more in Connecticut. I think B117 is the one that we're seeing most of in Connecticut right now from a difference in variants. We're about 374, the last data that I looked at. My biggest concern, or our biggest concern, shouldn't be the variants. Whatever it is that you do to prevent COVID-19, regardless of the variants, is the exact same thing. So you're wearing your mask, social distance, hand hygiene, and so forth. And, the next few weeks, very important. I do believe this, and it's from an epidemiology perspective. Our actions now determines how our summer looks. I really want to enjoy the summer, and I want everyone else to do. So be vigilant, be aggressive with our efforts. Get vaccinated when it's available. Communicate and help others. I think one of the things we've appreciated a lot in Connecticut over the last few months is how much people have reached out, educated, and helped their neighbors, right? Let's keep doing that, right? And let's get back to that really, really good place. 3.74, I think it was yesterday for our prevalence rate. We need to get that down to below 2 for a place of comfort. We're doing very well. I really do believe we can do much better. Thank you so much.
Thank you so much, Keith. Thank you, Bimal. Thank you, Liani. And again, thank you to all the teams. I just want to stress again, the vaccines are safe, they are effective, and the vaccines are how we beat this virus and end this pandemic. The President of the United States has gotten these vaccines, the Vice President, all the members of Congress, at the local level, our police chief, our fire chief, our health director, and thousands of members of our community. So please, do whatever you can to make sure that you, your family, your loved ones, and your community are protected. And that means, as Keith said, wearing your mask, washing your hands, but it also means getting that vaccine. We're going to continue to do everything we can to make it as easy as possible here in the city of Hartford. But I also want to stress that we have a long, long way to go. We have a long way to go here in Hartford, and we have a long way to go in Connecticut and around the country. But our focus here in Hartford is on making it as easy as possible with as few barriers as possible. So to that end, we invite our community to be part of the army that's signing folks up to get this vaccine. If you go to our website at hartfordct.gov, you can fill out a vaccine interest form if you want to get the vaccine, but if you want to be able to schedule vaccines for others, for your family, folks on your street, your neighborhood, anybody in your contact list on your phone, you can sign up there. We'll get you trained in how to do it, and you can be part of the team that's helping ensure that we close the disparity gap and get our community vaccinated. Happy to take any questions, and then I'm going to get the shot.
Yep.
The 6-month efficacy with the Pfizer vaccine.
Absolutely.
Can you talk a bit
Yeah, so one of the things that we got to ask in the beginning of the vaccine, which is a very good question, is how long is this going to last, right? One of the things that we don't have is time, obviously. So we didn't have like 2 years of study to say it's going to last 2 years. What we have now is Pfizer have tested 12,000 individuals who've gotten the vaccine from an antibody perspective, and we've seen very good sustainability for antibodies. So that's very good. So what we can say definitively that the Pfizer vaccine, or at least the vaccines, right, just based on the Pfizer study, will last at least 6 months with antibody sustainment, and that's huge. So we have that data. From the medical community, this is something that, if we were to do an educated guess based on how antibodies generally operate, we would have said this is the case. But now we have the actual solid data. So that's exceptional news coming out of Pfizer.
What can I answer?
Okay, hello, how are you?
I'm well.
Okay, obviously a lot of people are signing up today.
Yes.
Flurry of people heading into the system. What would you maybe be telling people who are now kind of embarking on this process to try to get in?
Sure, and I appreciate the question. Recognizing that there's this enormous and well-deserved pent-up expectation and desire to get the vaccine, and yet we have a limited supply. So we've been trying to balance that. What we've done is we are going to use the same process we've been using. You can go to hartfordhealthcare.org vaccines. That will lead you to a landing page. And we do continue to use our EPIC medical record to sign up. However, because we were expecting a lot of interest, if we go there and there is no vaccines available, what you can do is you can then register to put yourself in a queue. We now have a process to which you can give us pertinent information. We will then reach out to you when there's vaccines available or vaccination appointments available to allow you then to come in and vaccine you. You'll get notified. So it's a way to have people not to have to keep checking the site and making sure they're not just missing an opportunity. It allows them to raise their hand and make sure we're aware of you and we can reach back out. And that has helped us load level a little bit the expectations around people getting frustrated about trying to get a vaccine. Second piece, be patient. There's still a lot of time. We want to get as much vaccine as we can out. As we are now really starting to see better volumes of vaccines, we're pretty consistently doing 5,000 plus vaccines a day, which gets us to a place to where we're making good headway, and we expect that to be able to expand. As we get more vaccine, we open up more appointments because we have still a lot of capacity to administer.
I don't know if you know the answer to this. I saw that the 15 million doses of the J&J got foiled. Is that going to have an impact here on Connecticut?
I don't know. As of now, we've been in contact with the state closely around that, and it is not having any impact on our allocation at the moment. Don't know what the future looks like, but at least for the near future, what we've been allocated, they said we don't expect to be disrupted.
Do you mind saying and spelling your first and last name so we've got it on camera?
Not at all. It's James Cardon, C-A-R-D-O-N.
And your title?
Executive Vice President, Chief Clinical Integration Officer.
Dr. Carter, since this morning with the new tier of adults you can sign up for the vaccine appointments, any sort of hiccups with, rolling out appointments or anything like that, or signing up?
We certainly know that there's a lot more demand than we have appointments for, right? So that's the process we're trying to better manage as we go through this. It's the same functionality. It's just our ability to both ensure that people aren't getting frustrated by constantly having to search. And so by using this process to where you can kind of queue up electronically and then reach out, we'll get there. We also have the ability to call in for appointments, and we have that number on the website as well, to allow those that don't have the technology necessarily to be able to get appointments. A big focus of ours is to continue to make sure we're prioritizing vaccines to communities that are at risk in partnership with the state. And we have the ability to sequester those sites so that if you're coming from one of the zip codes that is a priority in the state, you will see additional appointments that would not be necessarily available to the general public to make sure we're not leaving any community behind. So all that functionality is something that we built and is operational and should help load level the people looking for appointments. Thank you. Anything else? All right, it's a great day. Thank you.